Welcome to our third part of the cardiovascular physiology revision, which is based on MCQ. So today we are going to have a set of MCQs on cardiac output and venous return. Cardiac output refers to the volume of blood that is the heart pump in a minute, and it's calculated by this formula: cardiac output equals stroke volume multiply heart rate. Stroke volume depends on three main factors. Stroke volume refers to the amount of blood the heart pump in a beat, and heart rate is the number of beats per minute. Stroke volume depends on preload, like how much blood is returning back to the heart, venous return or in the diastolic volume. So the more the preload, the more the stroke volume, the more the cardiac output. It depends also on the force of contractility of the cardiac muscle. So the higher the contractility, the higher the stroke volume. Like, for example, the more available the calcium within the cardiac muscle, the force of contraction will be better, and that is going to improve stroke volume and subsequently is going to improve contractility. And it's inversely correlated with the afterload. Afterload is the resistance the heart or the cardiac muscle faces while it contracts. That can be presented in the form of a high blood pressure in the aorta, for example, for left ventricle, or in the pulmonary, like pulmonary hypertension for the right ventricle, or maybe aortic stenosis in the left ventricle, or pulmonary stenosis in the right ventricle. That is considered as afterload, and that is going to decrease stroke volume and decrease cardiac output. So let's start with our questions for today. Which factor increases the contractility of the heart? So we have here a list of factors. Let's first exclude what is wrong here. So let's start from the beta blocker. So beta blocker is here wrong because beta 1, these are the receptors for sympathetic on the heart, and beta 1 stimulation result in an increase in contractility. So if we block these receptors, that is going to decrease, not increase contractility. Hypocalcemia is wrong. We know that contraction of the cardiac muscle depend on both intracellular as well as extracellular calcium. So a decrease in calcium level in our blood, that is going to decrease the contractility of the cardiac muscle. Decrease sympathetic stimulation, that is wrong. We know that sympathetic stimulation increase contractility. So a decrease in that's going to decrease in contractility. Increase in the diastolic volume, that is our correct answer, because the volume of the blood in the heart before it contracts, if it increases, that is going to increase the stretch of the cardiac muscle, and the increased stretch on cardiac muscle increase contractility according to the Frank-Starling principle of the heart. The reason for that is because when we stretch the cardiac muscle, there are more chances for actin and myosin to bind together. So more number of cross bridges will be formed, and that is going to increase the contractility. But of course, that happens within limits. A 70-year-old man presents with chronic congestive heart failure. Chronic congestive heart failure means the heart is not contracting, is not working efficiently. His cardiac output, of course, will be decreased because the heart is failing. What would most likely contribute to the decrease in cardiac output? So cardiac output is going to decrease because of a decrease in stroke volume, of course, because the heart is in failure, is not contracting efficiently, and that is going to reduce the stroke volume and subsequently will reduce cardiac output. Other options actually wrong, because increase in heart rate should increase cardiac output. Decrease in afterload, again, that is going to increase in cardiac output and enhanced ejection fractions, that is also going to increase cardiac output. A 35-year-old woman is diagnosed with hyperthyroidism, increase in the level of thyroid hormone. Which change is going to happen in her cardiac output? Of course, in hyperthyroidism, these patients are likely to develop hypertension because they are likely to have an increase in cardiac output. The reason for that is thyroid hormone actually acts as synergistic to sympathetic stimulation. Means it acts like sympathetic, and it actually activates the receptors for sympathetic, makes them like more sensitive. So that is going to stimulate the heart, and the stimulation of the heart is going to increase contractility and going to increase heart rate. So the correct answer here is going to be option C, which is an increase in both heart rate and stroke volume. That contribute to the increase in cardiac output, which is a feature seen in hyperthyroid patients. A patient with septic shock is admitted to ICU. Which of the following best describes CO and PR in the initial stage of septic shock? Septic shock, we have septicemia, and that septicemia causes a vasodilation. This vasodilation decreases peripheral resistance. So we have a decrease in peripheral resistance, that is for sure. In septicemia and septic shock, we have a decrease in peripheral resistance. But the correct fact here about cardiac output, especially in the initial stage of that septic shock, is cardiac output is going to be increased as a compensatory response. That is initially only. Later, cardiac output is going to decrease. So in the initial stage of septic shock, we have actually an increase in cardiac output as a compensatory mechanism trying to compensate for the peripheral vasodilation and the decrease in blood pressure. A 60-year-old man with a history of coronary artery disease. Coronary artery disease means the coronary that supply cardiac muscle there is some sort of ischemia. There is a decrease in the coronary blood flow to the cardiac muscle, means the cardiac muscle is not getting enough oxygen. There is lack of oxygen supply to the cardiac muscle. Undergo cardiac catheterization, that is to open the coronary and improve the perfusion of the cardiac muscle. He is found to have reduced ejection fraction. As I mentioned earlier, ejection fraction actually assists the contractility of the cardiac muscle because it measures the percentage of stroke volume to the end diastolic volume, like how much blood the heart is able to pump out of what the heart has inside it. So it measures how strong is the contractility. So what is the most likely cause of this finding? The reduced ejection fraction in this patient, because this patient has a reduction in the oxygen supply to the myocardium that is going to decrease the contractility, and the decrease in contractility decrease the stroke volume, and that is going to decrease ejection fraction. So here is like that. We have a reduction in oxygen supply, so that is going to decrease contractility, and the decreased contractility is going to decrease stroke volume, and the decrease in the stroke volume is going to decrease ejection fraction. So the correct answer here in this case is decreased contractility. Other options are wrong because decreased preload, we don't have like any indication in the scenario here that this patient has a decrease in venous return, or increase in afterload. Also, we don't have any indication to an increase in the afterload. Decreased systemic vascular resistance, that is decrease in the afterload. Again, we don't have here any indication about this in this case. A patient in the ICU has a pulmonary embolism. What impact does this have on CO, and what compensatory mechanism may take place? So pulmonary embolism means the right ventricle, while it pumps the blood to the pulmonary, here in the pulmonary, there is an embolus. So this means while the ventricle is pumping the blood into the pulmonary, is facing resistance. That is resistance. That is afterload. So pulmonary embolism represent an increase in the afterload on the heart. So increase on afterload on the right ventricle will cause decrease in stroke volume, and that is going to cause a decrease in cardiac output. Okay, so there is a decrease here in stroke volume and a decrease in cardiac output. So what kind of compensation might happen? Cardiac output equal heart rate multiply stroke volume. So if there is the primary reason for a decrease in cardiac output here is the decrease in stroke volume, the compensatory mechanism that is going to happen is to increase heart rate, trying to maintain cardiac output. So the compensation that will be that might be happening here is the increase in heart rate. So the correct answer for this case is a decrease in cardiac output because of an increase in the afterload with a compensatory mechanism, which is in the form of an increase in heart rate. What factor primarily drives venous return to the heart? Here we are talking about the venous return, the blood that is coming back to the heart through the superior and inferior vena cava. So we have superior and inferior vena cava, which collect the blood, okay, to the right atrium. So venous return to the heart depend on pressure gradient between peripheral veins. So we have peripheral venous pressure, and we have a central venous pressure, that is the pressure in the right atrium. So for the blood to flow back from peripheral veins to the right atrium, there should be a peripheral venous pressure that is higher than central venous pressure for the blood to flow back to the right atrium. So venous return has so many factors that affect it, like for example, our posture, our muscle contraction, our respiratory movement. So let's look here at this question. So what will be the primary force that drives the venous return back to the heart? Is skeletal muscle contraction. So the contraction of skeletal muscle compress. If we have the vein like that, the muscles are outside here. So the muscle compress on the veins, increase the pressure here, and that increase peripheral venous pressure, increase gradient for venous return, and increase venous return. Increased central venous pressure results in, this one I just explained, so the answer is quite obvious. So increase in central venous pressure, that is going to reduce the pressure gradient for venous return, and that will decrease venous return. A young patient presents with a syncopal episode, so he lost consciousness after blood donation. So there is here a situation where we have a decrease in blood volume. So of course, blood volume, that is the main factor in determining venous return. So if we lose blood, So this means the venous return is going to be less also. So decrease in venous return will result in a decrease. So decrease in blood volume, decrease venous return, and decrease venous return will decrease preload. Decrease in preload will decrease cardiac output. Okay, so cardiac output decrease. So when cardiac output decrease, that is going to decrease blood pressure. And when blood pressure decrease, the perfusion to the brain decrease, and that the tissue perfusion, including brain also, the perfusion to the brain is going to be reduced, and that will lead to the syncope. Okay, so here's the correct answer. Here is going to be a decrease in venous return. That is explains the situation in this patient. Which of the following increases preload? Okay, the blood that is coming back to the heart. Is it contraction of skeletal muscle, or expiration, or vasodilation, or standing position? So standing position is wrong, because while we are standing, because of the gravity, venous return decrease. Vasodilation means the vessel is dilated, so the pressure will be less. So decrease in the pressure will decrease venous return, because we are reducing the pressure gradient between peripheral and central. Expiration is wrong. Expiration is also wrong, because during expiration, our chest wall gets smaller. The chest wall gets smaller, and that will increase the central venous pressure. Again, increase in central venous pressure will decrease venous return. So we are left with option A, muscle contraction. This one already explained in the previous slides, because of the increase in peripheral venous pressure. Which mechanism is responsible for maintaining venous return during exercise? While we are exercising, of course, the heart rate is going to be high, so this is wrong. Sympathetic stimulation is high. This is right, because sympathetic stimulation causes vasoconstriction. Vasoconstriction means veno and arterial constriction both. So the venoconstriction here, constriction of the veins, will cause a increase in peripheral venous pressure, and that is going to increase venous return. Decrease muscular activity, that is wrong. It actually increase and also help in venous return. And this one is also wrong, because our respiratory rate also increase during exercise. How does the respiratory pump assist venous return? Our venous return increase during inhalation. The reason is, while we are inhaling, what happens is our chest wall gets bigger. So when the chest wall gets bigger, the pressure here, intrathoracic pressure, becomes less. So intrathoracic pressure becomes less, so the atrial pressure also, here we have the atrium, also the pressure gets less. So less central venous pressure becomes low. That will help in an increase in the pressure gradient between peripheral venous pressure and central venous pressure, and that promote venous return. So the main mechanism how respiratory pump actually help in venous return is by decreasing the thoracic pressure during inhalation, because of the expansion of the thoracic cavity. That expansion decreases the central venous pressure, and that promotes venous return. Here is very similar to the same concept about breathing. So a patient in the ICU is being mechanically ventilated with a high positive end expiratory pressure. So high pressure means we are increasing the central venous pressure. So increase in central venous pressure, how is going to affect venous return? By now you should be able to know. So it's going to decrease it. So several questions here about venous return to emphasize on the fact that venous return depend on the difference between peripheral venous pressure, that is the pressure in our veins, peripheral on the periphery, and the pressure in the right atrium, which is the central venous pressure. Increase in peripheral venous pressure, increase venous return. Increase in central venous pressure, decrease venous return. Which condition enhances venous return? So, of course, here that condition will be intravenous fluid infusion, because we are increasing the blood volume. So, increase in blood volume, of course, is going to increase venous return. An elderly patient is prescribed compression stocking for chronic venous insufficiency. Means this patient has insufficient venous return. Venous return is not good. So how do compression stocking aid in this condition? So you are compressing on the veins. So this compression is going to increase venous return via increase in the peripheral venous pressure. So the correct answer here is we actually promoting venous return in this condition.